Okay, where is the screen?
Good morning and welcome to Primary One Health's Community Health Advocacy Forum Breakfast. I hope everyone has their coffee or their tea or orange juice and bagels or eggs and bacon and turkey sausage so you can join us with this breakfast forum really designed to help us understand better what's going on in healthcare, how we can eliminate disparities, and address the social determinants of health. Forum breakfast. I hope everyone has their coffee or their tea or orange juice and bagels or eggs and bacon and turkey sauce.
I don't hear anybody.
Okay. Really designed to help us understand better what's going on in healthcare, how we can eliminate disparities, and address the social.
Okay, go ahead.
And today we're really going to focus in on one of the social determinants, employment. Employment is critical if we're going to be able to provide for ourselves, our families, to be able to provide food, housing, clothing, and to really ensure that our children are ready to learn and our adults are ready to earn. So this morning, as we talk about employment, I've got some of the best in Central Ohio who are going to share what's going on in the area of employment. We're going to start this morning's conversation with the president and CEO of the Workforce Development Board of Central Ohio. Lisa Pat McDaniel joined the Workforce Development Board of Central Ohio as the first president and CEO in November of 2016. The board developed strategies for placing job seekers on the path to family sustaining careers and working with employers to identify talent pipelines for their businesses. Prior to being with the Workforce Development Board, she was an executive on loan to the Affordable Housing Trust, an organization I know a little bit about, but a wonderful organization that's developing affordable or workforce housing throughout Central Ohio. She also spent 20 years with the Department of Development, ending her career as the development director. Welcome this morning, Lisa. You're on mute.
Yeah, being on mute is not going to help us. So I'm going to share. Thank you so much, first of all, for having me this morning. I appreciate having the opportunity to speak with everybody about what we do in employment. So yes, I am with the Workforce Development Board of Central Ohio. I'm going to tell you just a little bit about us, but let's start here about why employment is important to good health. According to the Robert Wood Johnson Foundation, on average, American adults spend more than half of their waking hours at work. And if you are someone who is working from home, it may feel like you're spending all your waking hours at work, because now we live where we work in some cases. A good paying job makes it easier for workers to live in healthier neighborhoods, provide quality education for their children, secure child care services, buy more nutritious food, all of which affect health. And Charlita alluded to that before we started. So we feel that the work that we do is incredibly important to making sure that people live happy, healthy, and high quality lives by having very meaningful and well-paid work. But let me tell you a little bit about us in case you don't know. We are a board, and our board is appointed by the Franklin County Commissioners and the Mayor of Columbus, so it's a joint board. Our core funding is federal funding from a federal act called the Workforce Innovation and Opportunity Act. So our board has to be led by the private sector. So we have a majority of our members are from businesses, and actually Primary One's own DeWitt Harrell is a member of our board. In addition, we have to have representatives from labor organizations, apprenticeships, community-based organizations, education and training organizations, and economic development, government. Wagner-Peiser is a state-provided program that has to be on our board, and then vocational rehabilitation. So our board is made up of 27 people, and they're all fantastic and really committed to the work that we do. What a workforce development board is charged with is developing a strategy that helps meet the economic development goals of our region. And then we work in conjunction with our state agency, with the Ohio Department of Job and Family Services. We provide strategic and operational oversight, and I'll tell you a little bit more about that, what that means as far as real programming. And we make sure that what we're doing is always providing maximum good services to both the job seekers who come to us looking for help to get employment and for those businesses that need to find a talent pool. What we're most known for actually is not the board. Probably what we're most known for is our Ohio Means Job Center, Columbus, Franklin County, located over at 1111 East Broad Street in the heart of Columbus. At the Job Center, which unfortunately right now, because we're purple as a county, just had to close down. But in normal world, it is where people can come, job seekers can come to do career exploration, a whole load of things, and I'll talk about those in a second. What I do want to say here, though, although I mentioned that we are closed right now for in-person visits, we are serving people virtually and by phone. And we've been doing that ever since the pandemic hit. So anybody who's interested in getting help from us, you can go to our website. There's actually a chat feature there. You can interact with us by calling the phone number. So you do not have to have access to the internet to work with us. We can work with you by phone. So as I was going to tell you, here are the services we provide at the Job Center. Career services are major focus for job seekers. So as I said, we can help you with career exploration. And that means by letting you know what opportunities are here in Franklin County and the Central Ohio region. We can help you prepare for interviews, make sure you have the right resume based on jobs you're interested in. We do assessments. We can help you figure out what are your skills and abilities, what would you be good at, what do you like, so we can point you in the right kind of direction for careers. We actually, if you need a credential or some kind of training to get the job that you want, we can help you identify what trainings are out there, who are good providers, what their track records are. And in some cases, actually many cases, depending on people's income, we're actually able to contribute to the cost of that training. And sometimes we can contribute to the entire cost of that training. If you are someone who are facing challenges like childcare, transportation, any other barriers, homelessness, if you come to us, we will make sure we connect you with the right resources to handle those challenges and barriers so that you are able to participate in training and credentials, get the job that is going to change the quality of life for your family. Also at the Job Center, we have partners there. So Impact, you'll hear from Impact later on today. You'll hear from Jewish Family Services. We have many of our community partners in the Job Center or connected to the Job Center so that we can easily connect you to them for their services. And we don't just, give you an address, a phone number and say, hey, go call them. We want to hand you off and make sure you're being helped by the right person. And we make sure we see that happen. And then, as I said previously, labor market information. So we want you to have all the information you need to find out what are the jobs, for example, that are pandemic proof. What are the jobs that are going to be growing here in Central Ohio into the future? And we help you do that kind of analysis so you make the best choices for yourself. If you're an employer, what's important for us, we have a business solutions team and a team of people with our partners who all work with businesses, Jewish Family Services being one of those. We help employers figure out how they can get access to talent for the jobs that they have. We also have on-the-job training programs. So if a company likes a person, but they don't quite have the skills needed for that job, we will help pay for the salary of that person while they're being trained, help develop that training program so that that employer gets somebody who does have the skills. We also work with employers to train their current incumbent workers, and actually we're doing that at a big scale, and I'll mention that here in a second too. We help employers look at best employment practices. We want to make sure that our employers are good employers, that they're employers of choice, that people want to go to work for them, because we don't want to help our job seekers get jobs with employers who are not good employers. And then we also bring employers together of like mind. One of our sector partnerships, our healthcare sector partnership, and Primary One is actually a member of that. We bring those employers together to understand what problems they have in common and challenges they have in common in getting talent, and try to solve those challenges together. So we have a youth program, and I don't know, perhaps Impact is one of our providers. They might mention this. We have a state mandated comprehensive case management and employment program. We never call it that. We call it AMP, Achieve More and Prosper. No 16 to 24-year-old is going to say they're in the case management and employment program. So we deliver this program in partnership with Franklin County Department of Job and Family Services. They use some of their TANF funding. We use our federal funding, and we blend it together. We have a dual program. We work with kids who are in school, and we also work with kids who may have, for some reason, no longer in school, dropped out of school, or finished high school, but didn't really come out with a plan. We coach them towards employment and employment with benefits. And the goal is that they have a job that allows them to be self-sustaining, self-sufficient, able to take care of themselves and a family if they have one. Things we do there is we do education and skill assessment and support. You know, what we're hoping to do is help point them in the same way we do with adults into career exploration and planning. We can provide them work experience so they can test out different kinds of jobs and careers and find out what it is they really want to do. And our goal in the end, when they're finished and they leave us, is that they're either in employment, they're in military service, they're in an apprenticeship program, or they're in some post-secondary education and training. Now, AMP is delivered not directly by us, but by community partners chosen through an RFP process. Our current providers are the Academy of Urban Scholars, Columbus Literacy Council, Eckert, ETSS, Impact, Lead the Way, and St. Stephen's Community Center. Now, in the past, people have known us and our former organization, COWIC, as someone who, or as an organization that was able to do summer employment. But the state, this particular program is state mandated, and it requires us to put all of our youth funding into it, which means that the board no longer has funding to run a summer employment program. So instead, they would need to participate in the AMP program, which is a year-round enriched program, which does have potentially a summer employment component, but that is not the focus of it. And that's a common question we get. So I just want to point that out. Let's talk about employment in a time of pandemic. We have been working very hard since March. As you may know, unemployment reached a peak of 14% here in Franklin County. Right now, we're down more around 8%. The numbers just came out the other day showing that the state was close to 5.9%. So it's possible that Franklin County is lower. But what we have to understand is when you hear unemployment numbers, you are not hearing people who have basically given up and are no longer participating in the workforce. So that unemployment number is based on people who are actively engaged still in receiving unemployment benefits and still actively looking for work. But what we know is that given all of the things that are listed on my slide here, some people are choosing not to go back to work. And in fact, something that we are very concerned about is that many women, especially women of color even more so, are having to step out of the workforce completely because they have to care for their own children. Their children aren't able to be in school and they have no other way to take care of them, so they're choosing to be home. And this is at all income levels. And what that means for us as Central Ohio is when the pandemic is over, we will have many people and many women who have stepped out of the workforce and may need to, again, rehone skills, get other credentials, and try to pick up where they left off. And that can be a challenge. So we are already starting to focus on this. But the other challenges, many of you may know well, right? Broadband access. If we didn't think broadband access was as important as some of us did think it was, I think everybody gets it now. The state is trying to invest in having broader access, but it has to be affordable. So in our urban city neighborhoods, sure, broadband goes by them, but the cost to access it is so expensive. Childcare was closed or limited during this pandemic. Some childcare businesses aren't able to even come back because they had to close down. I mentioned school children at home. And then the other thing is sick leave, or the ability to have paid time off, or the ability to work from home. Every job, many of our essential jobs cannot be done working from home. And so that is a real challenge that we are working on. So I don't want to take up all our time because we have all these other speakers, but if there's any questions or comments, I'm certainly happy. Or please feel free, this is my address, my email address. Feel free to email me and questions, and we'll try to get you answers. So
Chris, thank you very much, Lisa. Chris, do we have any questions in the chat box at this point?
Not at this time.
Since we don't have any from our audience, I wanted to ask you, Lisa, a question about the AMP program. What are the ages for that program?
So the ages for that program are 16 to 24. If you are enrolled in the program before you're 24 and we're not done working with you, we don't just kick you out the door on your 24th birthday. We're committed to making sure you get what it is you need and that we have a successful outcome for you. So.
Very good. And then you mentioned that the state of Ohio has currently a 5.9% unemployment rate. Can you just reiterate the point once again, that whether it's 5.9 or 8.6 in Central Ohio, that is only including those who are actively looking and on unemployment? Can you just stress
yes,
that? Because a lot of people think that's the true number.
Right, that is true. A better number is looking at what's called the labor participation rate. If you look at that, I do presentations on just that. It seems every other week, sometimes every other day. Right now, our labor participation, so we have, if you think of it this way, we have around 700,000 plus people who are actually could be in the labor force in Franklin County. Right now, we have over 57,000 people who are not working, who could be working. So now there are potentially people in there who at this particular moment may be sick or facing some reason why they can't work when normally they would work, but still 57,000 people. That is almost as big as the city I live in, Dublin. I mean, that's bigger actually than the city I live in, I think now at this point. So we have a very large number of people who are not employed. And also, Charlene, I might add, of the people who are working, we have a lot of people who are underemployed and a lot of people who are working 2 and 3 jobs before the pandemic hit, especially, who are not making enough money to sustain their families. So when you look at it that way, we're looking at a quarter or more of our total workforce who are not participating, are underemployed or unemployed. And we can't have, we're not going to do well in our economy. We've lucked out. We've done well as an economy, but that is not going to continue for the future if we don't do everything to make sure people who want to work are able to work at the top of their ability and make a self-sustaining wage.
Well, thank you very much, Lisa. And we know that you're going to have to leave a little early, but we thank you and we thank the Workforce Development Board for all that you're doing in Central Ohio to prepare people for work, careers, and certainly to assist with the training needs of employers. We're going to move on to our next speaker. And I just want to share, is there a question, Chris?
Yes. Someone asked if Lisa could put her contact information back on the screen briefly.
Yes, hold on. I will get right to it.
And while Lisa is doing that, I just want to share with everyone, you'll notice this beautiful water background behind me. And I'm just wishing, I'm here in Central Ohio in the dreary Saturday morning with you, but I just wanted to lift my spirits by remembering a wonderful trip I took with my college roommate to Mexico. So that's why I'm using that as my screen background. And I think we've got to do these kinds of things to lift our spirits, to sometimes come out of the blue, to just bring yourself out of maybe a depression, maybe out of being anxious. We've got to find ways, whether it's taking a walk in the fresh air, even in the rain, whether it's dancing, whether it's singing, whether it's doing chats online with your friends, but we've got to lift our spirits up so that we can be, again, ready to learn and ready to earn. Thank you, Lisa, for sharing that information with our audience. And I'm going to go to our next speaker, someone I know pretty well, Robert, but better known as Bo Chilton. Bo is the CEO of Impact Community Action. Community Action came into being at the same time as our federally qualified health centers, were sister programs, including Head Start, Community Action, Medicare, Medicaid, all came about during the war on poverty. And he's been the CEO for a few years. He also serves on the Human Services Chamber and Learn for Life, also on the Central Ohio Workforce Investment Corporation. He was on that entity before it kind of absorbed into the Workforce Development Board. He's also on the board of the Ohio Association of Community Action Agencies and the Urban Resurrection Development Corporation. He's originally from Springfield, and I know his family was close to that famous John Legend family. So I'm going to let Bo take it away.
Thank you, Charlita. I appreciate you always trying to provide information with the public. It's something that I learned working with you at City Hall, the importance of public hearings and sharing information. So thank you for the opportunity. Impact Community Action is part of a national network of community action agencies. Charlita mentioned there are over 1,100 community action agencies across the nation. There are 48 here in the state of Ohio. Collectively, we serve all 88 counties. Impact is the designated community action agency for Franklin County. So we serve all residents of Franklin County who are at 200% of the federal poverty level or less. We do that through a number of programs and services. And so kind of taking from the parable, if you teach a person to fish, they will eat for a day. I'm sorry, if you give a person a fish, they will eat for a day. You teach them to fish, they will eat for a lifetime. But I always challenge that assumption and say, you're not going to eat for a lifetime unless there's some pond, river, sea by which to cast your rod and catch that fish. So we give people fish through our emergency assistance programs, trying to really stabilize families who are in crisis through a very robust rent assistance program, utility assistance, have a great relationship with the furniture bank, providing material assistance for people who need furniture. And then we teach people to fish. through our empowerment services. I have Joelle Thomas Jones here today. She'll talk more about our programs and services in empowerment services, but we teach people to fish through workforce, financial literacy, computer literacy, working with AMP youth ages 16 to 24. And then we also have energy efficiency programs with our weatherization department, where we'll actually go in, weatherize people's homes, and on average help them save about 28% on their utility bills. So we do try and take a comprehensive approach. Charlita mentioned the social determinants of health, and our focus is on employment. But certainly we want to try and address the needs comprehensively. And while we are a social service agency that provides multiple services, the one thing that we really want to focus on is the best social service program you can have is a good paying job. But sometimes in order to get that job and keep that job, there's some retraining that needs to take place, some upskilling. And so that's where we try and focus on career pathways and making sure that we're training people for the jobs of the future and making sure that they're living wage jobs that you can sustain a family on. One of the things that we need to pay really close attention to is the market changes. We know that we have a lot of people who are underemployed, working 2 and 3 part-time jobs to make ends meet and don't often have health care. One of the things that I'm a big proponent of and an advocate is that we should have universal health care. We're in the wealthiest country in the nation, potentially in the history, and we are the only industrialized developed nation who does not have healthcare for everyone. So that's a critical piece, but we need to realize that most of the healthcare that we receive comes through our employment. So that's why we need universal healthcare. So I'll get off of my soapbox on that, and we'll drill down a little bit more on the types of services that Impact provides. But before I go there, I also have the distinct pleasure of serving as a board member on the Workforce Development Board of Central Ohio. And Lisa has been a phenomenal leader in moving us forward and bringing us together. And so that's one of the things I wanted to talk about. We created, at her behest, a workforce advisory council. And so what that means is that we brought together many of the workforce development providers, Jewish Family Services, Columbus Urban League, a lot of the settlement houses and others who provide workforce. And we said, okay, we know that we've all been kind of out here independently working. We collaborate and refer back and forth, but we really didn't have a workforce system. And so we said, okay, we want to take advantage of a collective impact model where we come together, have a shared vision, a common agenda, and a way of identifying where are the gaps in our community for training, as well as the needs of employers. Where is the disconnect? If we have employers who have open jobs and we have workforce programs that are providing great work readiness training, but is it targeted to the jobs that are open? And so that's where we wanted to kind of shift our focus and start working together. And so we created the Workforce Advisory Committee. We're now collaborating. We're going to be working with a facilitator to help us with the strategic plan. There's a group of about 14 of us right now. And once we have clarity on our direction, we're then going to invite other workforce development providers to join us so that we can have a true workforce system and address the needs of the community. So with that, I'm going to kick it over to Joelle Thomas Jones to talk a little bit more about our workforce and our focus really on kind of career pathways.
Thank you, Bo. Good morning to everyone. As Bo said, my name is Joelle Jones, and I am the Director of Empowerment Services at Impact Community Action. And as we navigate our way and brainstorm how to meet the employment needs of our population in a time of COVID, I think that is one of the ways that Impact is being very intentional about that. So our population, our customers who come to Impact for services, a lot of them have already encountered barriers and obstacles to employment. So on top of what they've already experienced or going through, now we have COVID here as well. So what we do at Impact is we're very, very intentional about our programs and the services we offer. And so we know that employment is the way to self-sufficiency and sustainability for families. But we do not underestimate the obstacles that families or customers encounter in getting to that. So we offer several programs. We offer a Roles to Work program. Roles to Work is a program where people can come in and get into CDL training. And I'll tell you this a story. So I'm there about 2 months. And I know the important work that we do. But I'm gonna share a story with you. We had a young lady who came to our Roles to Works program, a mother of two, single mother of two, making about $10.75 an hour at Walmart. She matriculated through our Roles to Work program, and she was offered a job at about $51,000. That is literally changing the trajectory of one's life. Not only her, but everyone that she surrounds, her cousins, her nieces, her nephews. And it wasn't just about Impact providing that pathway for her, but it was also Impact and our staff helping her to know not just what she needed to do, but why she needed to do it. And so that's one of the things that our self-sufficiency coordinators work with our clients. Why? We know what employment does, but why is it important? We know that in the immediate need, that we have immediate needs to pay our bills, to meet Maslow's hierarchy of needs, right? But what's beyond that? What happens to families once we meet that sustainability? Why do we work? And so through our programs, we have, like I said, Roles to Work. We have our Build Up Construction, which is NCCER certified. So when they complete that program, they receive a national certification and they are ready to work in construction. Again, changing the trajectory of one's life. And so again, I talk about those barriers. So when a person comes into Impact and they made the decision that they want to retool their skills to work, they sit down with a self-sufficiency coordinator and we talk about that. What are your barriers? And we help them with that. We can help them with funding through supported services. If they enroll in one of our programs, our Roles to Work, our Build Up Construction program, we offer even an incentive stipend pay with them every week, $200. And that is not a payment. That is understanding that Impact understands that if a person can't buy food, they can't provide transportation, they cannot concentrate. So what we do is, again, we offer a stipend to them as they matriculate through our program to help offset some of those barriers. So they come in, they meet with a self-sufficiency coordinator, they're in their classes, and they graduate. And so what we've done also is we are intentionally collaborating and making partnerships with employers. Are we on track? Do our programs meet the needs of employers in this region? And so we are constantly, again, rethinking that, retooling that, making sure that we're on par with what is needed. In addition to that, when people come into our programs, again, we know we have barriers, we have things like nature. And so one of the reasons why people do not succeed at work is those soft skills, right? The ability to deal with conflict, the ability to understand that coming to work is on time and matriculating through your job is really important. So before they enter our programs, they go through either a week long, depending on which program they choose, or 2 weeks soft skills, where they work one-on-one with our facilitators, and we go over those communication skills, coming to work. But what we do is in the first day, we really we drill down to that personal issue of what is keeping that person from being successful in work. And so once we find that out, we have, again, partnerships with our community partners in behavioral health care that we can do a soft handoff to. So we know that you have issues, but that cannot bar you from working. And so we don't let people use that as an excuse. We use that then as, again, as a tool for them to know, these are my barriers, these are my obstacles, but in that, I can still get a job and be self-sufficient for my family. So at Impact, we do a lot. There are several pathways. They can come in through our employment programs, like I said, Roles to Work, Build Up Construction. We are implementing in January 2021 another program, our EKG Technician program, our IT, information technology, help desk analyst program. And also, again, being intentional in understanding our environment and our customers, we have also implemented an alcohol and drug abuse counseling program. So what we do at Impact is holistic. So, and I love to say it this way, a father or mother can come into Impact Community Action for emergency assistance. And once that crisis is met, we also can say, okay, now that that need is met, your utility need is met, what is your next step? How do we ensure that we do not get there again? So then we send them over to my program, Empowerment Services. Now they're getting credentials, they're getting employment skills, they're getting connections with employers. And so we work that way, right? And so then they have children in the home and they can go through our youth services program, AMP, which Lisa Pat McDaniels and Bo talked about, Achieve More and Prosper from age 16 to 24. So it really is a holistic program that can really meet the needs of the entire family. I want to make sure that talk about some other things, but so in empowerment services, using the word empowerment, we empower the individuals to make choices that lead towards self-sufficiency. And Bo Tilton says it best, we are literally fighting poverty. And so poverty is one way, income, right? But also poverty is also behavioral habits, things that keep people in poverty. And so that is one of the things, I think one of our marquee services that we do offer, not just helping you get that tool, not just helping you get that credential, but really garnering that one-on-one relationship with that family, with that individual, as how we can overcome those barriers, not just during the program, but even after you graduate from our programs. And what I mean by that, so that same young lady, she graduated, she went from, almost $11 an hour to 50-something thousand dollars an hour, but she still has obstacles. So we have funding where we helped her with get her boots and with her GPS system and her clothing to make sure that she is ready for work day one. And so as we, again, as community leaders and people who work in this environment, as we traverse through this COVID climate that we're in, we understand the impact that our clients have already encountered barriers, and now on top of COVID. So again, so we're intentional about that. And again, it's really interesting because I just told a client the other day who came to my office. He said, I don't have a computer, I don't have internet. But one of the things we do, like with workforce development and looking at the labor market in Columbus, there are still pathways to employment towards self-sufficiency for families if they have the information. If they have the information. So if you don't have computer skills and that is not your forte, you can come to our skilled trades program. And so what is happening is that we have these programs, but what we're seeing at Impact is we're seeing people who come through our doors who've never come through our doors before. And people are looking for a way, again, to retool to make sure that they're ready for work in this 21st century day. And so we don't know what 2021 is going to hold, but what we do know at Impact is that we do have solutions, we do have credentials, and we do have assistance, again, to help families matriculate through this process efficiently. And we are essential services at Impact, so we do not close. We are very aware of what's happening during the pandemic. So our classes are offered virtually. We have this beautiful building now at 711 Southwood Avenue. So it's humongous. So for some of our classes, we have an enormous amount of space and we can properly hold our classes and people can safely social distance. So, well, that was before the order came last week. So I'm not sure what we're going to do with that now. But so what we are doing is that we are ever changing. We do not stay in one path. We continually monitor what is happening in our environment, what's happening in our region, What are the needs of our customers? And we have the ability at Impact, again, at any moment to change course and change direction. And I think that is one of our greatest gifts that we give Franklin County. And for everyone who walks through that door, you can come in through emergency assistance, you come to empowerment service, you get a credential. We have a pathway for children, like I said, for youth and from ages 16 to 24. So again, a holistic approach to overcome these obstacles and get ready for all the opportunities that Franklin County has to offer. Again, I'll just say we have some new programs that are going to be starting up in January 2021. That is our EKG technician, and we know healthcare is a driving force here in Ohio. Our information technology, again, help desk analyst, CompTIA certification. We are going to be partnering with vendors to hold those classes. And so, again, we are helping people who may come underemployed or unskilled obtain credentials that can get them back to work. In a nutshell, that's what we do in empowerment services. Again, we are empowering individuals. And so, as again, I'm going to end on this. As we navigate through this pandemic and looking at ways to stabilize community, I never thought until I read Charlita's introduction about employment in COVID that we are essentially a health care agency. We help with the mental health of individuals. And once the mental health is once people feel good about themselves, then they can concentrate on how to do other things. And if the mental health is not good, if they can't take care of Maslow hierarchy needs, everything else is unstable. So I never, again, Charlita, I never think about it. I didn't think about us as an avenue towards healthcare, but that's exactly what we are at Impact. We're on the other part of that, but definitely we're all in this together, and this is truly a community collaborative. If they have any questions about our programs, I definitely, Charlita and them have my email address. We can send that out to anyone who's in the audience. Please give us a call, give me a call, stop in, come and take a tour after the pandemic and come and see what we do there at Impact. We're doing some mighty work for some very deserving individuals. That's all.
Thank you very much, Joelle. And thank you, Bo, both for your presentations. Chris, do we have any questions in the chat box?
No questions, but someone was said, wow, that is amazing about that story that Joelle shared of the woman who went from working to Walmart to earning a much more livable wage. So.
Absolutely.
Well, we really appreciate what you're doing. And one of the things that I do want to share before we go to our next speaker is that, you know, we have many partners in the community, and Primary One Health really wants to make sure that we're connecting our patients who are our customers with those services, those needs that, as Joelle said, the hierarchy of needs are met. And certainly employment addresses so many of the barriers people have to work, not having a place to call home, not having enough food, being food insecure, not having the clothing necessary, not being able to take care of their teeth and their vision so that they are ready to work or ready to go to school. And I do believe you shared that with this latest advisory, this stay home advisory from the county and from the state, education and training and work are still allowed. So people can still come. They may have to come with appointments to make sure that you don't get bombarded with people coming into your facility. However, it's essential that people get the skills and training that they need. And my colleagues that are online from Primary One Health would really be upset with me if I didn't ask, certainly Impact Community Action, but I'm going to ask the other presenters as well. Have you thought about education training programs for medical assistants. It is a career that we are in dire needs for medical assistants, not only Primary One Health, but every healthcare provider in Central Ohio is very much interested in hiring. If you know of any medical assistants, send them to Primary One Health. We need medical assistants. The hospitals need medical assistants. And there is a career path. If you choose to go into any of the professions, you can go from medical assistant, and I'm going to put a plug in for Primary One Health. We pay half of the tuition. So, you know, it's a plus. You can go from medical assistant and continue with your education and training and move into some of the other paraprofessional positions. You can go into nursing, you can go into physician assistants, optometry, etc. So that's one area I'd really like you all to zero in on. And I'm speaking on behalf of all of the healthcare providers in Central Ohio.
Absolutely.
Charlita, I'm glad to hear you say that. We are all about creating partnerships and being responsive to the needs of the community. So we will go to work on that. And I'd love to partner with you so that we can get the training, leverage our resources, and create those pipelines.
Wonderful. Thank you very
Same
much.
here.
Great.
Same
Thank
here.
you, Karen. Wonderful. Thank you. Next, we're going to go to Aminata Soko. And I'm probably not saying her name exactly right, so I want her to pronounce it because I believe it's important to pronounce people's names correctly. She is the director of women at the Women's Business Center of Central Ohio, which is a part of the Economic and Community Development Institute. Many of us know it as ECDI. She provides direct client services to include training and one-on-one counseling. But what is most important is she's only been in Central Ohio for about 2 years. She's from West Africa, Mauritania. And so welcome, and we're glad to have you here with us this morning.
Thank you so much. Good morning, everyone. You did pronounce my name correctly. My name is Aminata Soko. So I am from the Economic and Community Development Institute. I'm the director of the Women's Business Center over there. And what we do at ECDI is basically help individuals create or grow their existing businesses. And we strive to really help our clients be job creators in Ohio to help our local economy grow, our local and national economy. I mean, it's a ripple effect at the end of the day. So today I'm going to go through some of our programs, what we offer, and basically how we strive to, at every step of the process, lending and coaching process, to measure job creation and really encourage our clients in their endeavor to employ people. And we've also worked on adapting our trainings to include HR trainings in this pandemic era. So I'll start. Let me actually make this full. All right, so our mission at ECDI is to invest in people to create measurable and enduring social and economic change. And we do it through small business training, access to capital, and one-on-one coaching to businesses. And we are a CDFI. Basically, CDFIs are economic. I'm sorry, let me move this here. Okay, so CDFIs are community development financial institution. And what CDFIs are, they're private organizations that serve low income, low wealth, and underserved communities to really help them enter the economic mainstream. And basically, CDFIs are, their target market are individuals who are underbanked and credit invisible, and really help them really enter the economic mainstream, as I said. And ECDI, we are one of the top micro lenders in the nation. So a quick overview of our lending and how we basically offer financing. We offer small business loans for inventory, equipment, and working capital. And we're able to go up to $75,000 for a startup business. And sometimes we can go up to $250,000 if we get a guarantee from the SBA. And we offer up to $350,000 for existing businesses. And our credit score is about 590, well, minimum 590, but I was a loan officer before being the director. We've given loans to clients who had lower credit score. We really take a look at the holistic view. So we look at your business plan, your financial projections, and also really your character as well is something that we consider. So it's not just the credit score. And our loan terms are mostly 60 months. So training is something that we also augment with our lending. We believe that you can give someone financing, but to be successful, you want to give them the training and the coaching to go with that financing. Because as we all know, someone might be a great baker or a great barber, but if they don't have the business skills, that might lead to business failure, unfortunately, in the short term. So therefore, at the Women's Business Center, we offer the small business training, the one-on-one coaching to go with the lending. And before the pandemic, we had co-working space and then meeting space for our clients to meet with their potential customers. We also have something called a professional advisory network, where a group of professionals in different business areas come and work with our clients. So this includes HR, legal, e-commerce, and these are volunteers and they help our clients. And we're revamping our professional advisory network. So if anyone is interested in volunteering to help small businesses, we're always happy. So looking at the small business training, like I said earlier, we have been really looking at HR trainings to really try to adapt to the needs currently. And for example, one of the trainings that we have coming up soon is HR during COVID-19. So basically how to hire new employees during this time. And I'll go in more details about what we cover during these trainings. So a little bit about the metrics that we measure. So since we started in 2004, we've output $60 million in loans. We've served about 2,800. We've given about 2,800 small business loans, and we've served about 16,900 individuals and created over 9,000 jobs in Ohio, created or retained about 9,000 jobs in Ohio. As I mentioned earlier, so job creation is a key metric that we measure from the start, from the beginning when we meet a client till the end when they close their loan. And I'll discuss more how we strive to really build in this metric throughout the process. So I want to touch a little bit on jobs and their impact on our lives. Joel mentioned earlier.
We can't hear you. Can you unmute yourself?
Can you hear me now?
Now we.
I'm sorry. What I was saying is that so ways that jobs impact our lives. And the first thing I was mentioning is that personal income, it is for our jobs that we are able to get personal income. And that is a critical component to be able to meet our basic needs. Like Joel was saying, the basic needs of food and shelter. And income is a critical component of the social determinants of health. Right, and it is through our jobs also that we make these critical connections, our social network with our co-workers and the clients that we meet every day. And also identities. I mean, a lot of us hopefully are very passionate about what we do. And so our identity and what we care about is also something that is impacted by our jobs. Of course, benefits, health insurance, vacations. Vacations are always good to help reduce stress. So these are things that we get out through our jobs too. And one interesting idea concept I came across is the health wealth gradient. Basically, it's showed on the graph on the right, showing that when people have higher income and higher control over their jobs, their health also, the quality of their health as well increases. So, which is pretty obvious, but I thought it was interesting concept. Okay, so next I kind of want to discuss some of the skills that we've seen are really critical during the pandemic as people are looking for jobs and what employers are looking for. So the number one is really creativity and innovation. We have seen our clients, our businesses really have to pivot during the pandemic. This is something that we talk about every day during my coaching sessions and our training sessions. And because the business owners have to pivot and be creative and find new ways to really make their business, help their businesses survive and thrive, they want employees who are creative and innovative as well. So that is really important. And another thing is data literacy. Data is a really critical asset for any organization, and I think we're mostly nonprofits here, so you can relate. And right now, with the right data, companies, businesses, small and big, are able to better predict the impact of future business disruptions. And they want people who are well equipped, who have good data literacy skills and are able to really play with the data and come up with good predictions. So that is, I thought it's an interesting skill that we know, but we might not always talk about. Of course, digital capabilities are a critical skill as well. And finally, adaptability and ability to pivot. I mean, as employees and business owners, we really have to learn to be adaptable. And so I want to kind of share at ECDI how we encourage job creation through, as I said, I mean, we're really focusing on small businesses, but as we're working with our small businesses, we have several processes that we have in place to ensure that they really create jobs in Ohio, and we measure that. So the first thing, before even they go through the loan process, when we meet the clients to discuss how much they should be borrowing and their budgeting session, we discuss payroll expense. We always recommend to have at least 6 months of payroll expense built into their loan. And that, I mean, 6 months is not a lot, but still that's a minimum that we recommend, because that will help them at least, you know, as they're starting the business, before making the initial revenue, you have at least 6 months of money built in. So that is one way that we really help them make sure that they're thinking ahead and they're not firing people, I mean, the first few months as they start the business. The next thing, in our business trainings, we also bring in HR professionals to teach some of the classes. So for example, we have a class coming up, like I mentioned earlier, talking about hiring during COVID. How do you manage remote workplace? How do you address a positive exposure in the workplace? So these are all things that we need to think about right now. So we want to bring those classes and really have our businesses be thinking about all these critical things. And the next component of job creation, basically for our lending process at the very beginning, we have a job creation form that we have our clients fill out. And in that form, we ask them how many jobs they'll be creating with the loan they intend to take, how much are they going to be paying their employees, how many hours are these people going to work. So at the very beginning, we want them to start thinking about job creation. So that's at the start of the process. And once someone is approved for a loan, at the very end, when they're closing their loan, that discussion also comes back, the same questions. How many jobs are you going to be creating? How much are you paying these clients? And very recently, we added another component in that form to really ask them to sign a pledge to say that they'll be doing their best to hire individuals in the low to moderate income, individuals who are low to moderate income, because that is our mission. We strive to serve people who are low to moderate income. So we want to pass on that impact as well as they hire in people to think about that. So, I mean, pretty much everyone signs it. Do they do it or not? I mean, I think every opportunity that they get, they do it, but at least we want to do as much as we can to encourage that. So basically, those were just few things that I want to share with you. If there's any questions, I'll be more than happy to take.
Thank you very much, Aminata. And I want to see if there are any questions in the box.
Yes, someone said, thank you, Ms. Soko. As we heard from the first speaker, unfortunately, women are making up a greater portion of unemployment. How does your organization address their unique needs and challenges?
That's a really good question. So the Women's Business Center, actually, our purpose is really to serve women entrepreneurs. We don't discriminate. I mean, we serve men as well, but that is our sole purpose. So before the pandemic, the center is really a welcoming space where women can come in and share resources, share ideas, share business. And I mean, some of the businesses that we have, they need each other's product, each other's services. So really create a growth minded environment. And also one of the other things that we have is called Coffee and Chat. It's one of our workshops. It's not really a workshop, but it's more just a networking event where it's our members, so our women members come and talk about their businesses and talk about what strategies that they have to be able to survive and thrive during the pandemic. So they share ideas, and we do it remotely right now. We used to have it, but right now we do it remotely, and it's still working fine. So these are just few things, but also when we have a lot of our loans, we have special focus on women. And so we have funding from several sources, but some of our funding is focused toward women and LMI, low to moderate income individuals. So we encourage our clients, women clients, to apply. So these are just few things.
Are there any other questions before we move to the next speaker? Thank you. Karen Mosenter is the Chief Executive Officer of Jewish Family Services, and she became a member of Jewish Family Services in 2017. She came in as their Chief Operations Officer, and they saw her talents, and when there was an opportunity, they moved her up to the Chief Executive Officer. She brought diverse experience and skills with a background in law, education, nonprofits, and philanthropy. During her tenure at Jewish Family Services, she's led efforts to drive new strategic partnerships, diversified funding streams, and integrate service delivery across the agency. She spent 4 years in Cleveland with the Fund of Our Economic Future, a philanthropic alliance of funders driving economic growth and equitable access to opportunity in Northeast Ohio. Karen, take it away.
Okay, thank you, Charlita, and thank you, everyone. Really appreciate the opportunity to be here this morning and to share and to be here with my partners and to learn more about what you all are doing too. So I'm going to share my screen here. Let's see. Hopefully you can see our overview. So I'd like to give you a little bit of background on our agency, reinforce a lot of what you've heard from our partners. And let me see, can you see the full screen now of the slide? Is that the view you're seeing?
Yeah.
Okay.
I think so.
I just want to make sure I'm sharing the right screen because I've got two screens here.
I'm looking at the YouTube feed to make sure it's the right one, but there's that delay. So,
oh, okay.
Actually, I see the view where it's your main slide and then your next slide.
Okay, that's what I was afraid of. So let me jump over. I'll put it on my other screen, and I may have to. Let's see. Here we go. We'll try it this way. I may have to look sideways a little bit. That'll give you a better view. Okay, hopefully that'll work better, but I'll go ahead and jump in. So our organization is Jewish Family Services. We've been around for just about 113 years. And our mission is to help individuals and families achieve economic self-sufficiency and emotional stability. And so I want to give you a little overview of the agency, but also to put it in context and to introduce Viviana, who is one of our more recent clients during the pandemic. When Viviana came to us, she was the mother of 3 children. She had no job, no housing, and did not have a supportive network. She was receiving government benefits and was really looking to change the trajectory of her life for herself and her children. So we'll come back to Viviana, but I wanted to give you a little context here of the types of people who really benefit from our services and kind of the way we provide services. So the values of our agency are really grounded in the 3 questions that were posed by an ancient Jewish sage, Rabbi Hillel. The first question is, if I am not for myself, who will be for me? And that reflects our history that we were founded by the Jewish community 113 years ago to serve immigrants who are coming from Europe and making their home in Central Ohio. And we do continue to serve the Jewish community. But Rabbi Hillel's second question also reflects our fundamental value. And it is, but if I am only for myself, what am I? And you'll note the question is not who am I, it's what am I? And that really shows the value that if we are only for ourselves, we have lost part of our humanity. And so at Jewish Family Services, we don't only serve the Jewish community, we serve the whole community, and particularly those who are most vulnerable. The third question of Rabbi Hillel is our call to action. If not now, when? And it's never been more clear, I don't think, than it is today, that there is an urgency to the work that we do. So because of our name, oftentimes people think we're not for everybody, that we're Jewish Family Services, so you must have to be Jewish to use our services or to work at our agency or even to be on our board. That is not remotely the case. We're not for everybody? Oh, wait, yes, we are. So here's what we do. Two major buckets of our work. The first is workforce development, and that is helping people find jobs and helping companies find and retain talent. And the other side is community services, and that is counseling, case management, service navigation, and recently an awful lot of emergency financial assistance, COVID related for our clients. And also really everybody is doing case management and service navigation right now. Even our career counselors are helping people connect to services, our services, and those available in the community, and including some of the ones that you've been hearing about this morning. And we are really pride ourselves on having an integrated service model, that these areas are not siloed, but we are working with people through whatever door they come in to provide services across the agency. So who we serve is everybody in Central Ohio, every single zip code, and all kinds of people. Our job seekers range from entry level to C-suite professionals. We have workforce programs that serve youth aging out of the foster care system, non-custodial parents who owe child support and need employment so they can support their families. We have the largest refugee workforce programs in Ohio. We have programs that serve young adults who have social cognitive challenges, many of whom on the autism spectrum, helping them get into employment. And the vast majority of our clients, our workforce clients and other clients, are people experiencing poverty. We also have a large workforce program that serves dislocated professionals, so people who've lost their jobs, really at all levels, and more of those, sadly. And we serve individuals and families in crisis. We serve older adults and their caregivers, and that includes all of the areas survivors of Nazi persecution, Holocaust survivors, of which there are a little over 200 in Central Ohio, and I'm sad to say that many of them are also living in pretty severe poverty. So how we do it, we have a wraparound service model. And that means whatever door people come in, so quite often it's the workforce door. So somebody comes, they hear that we can help them find a job. And so during our intake process, we are figuring out what is going on in their lives. Because we know, and as you've heard this morning, if we can help people find a job, but if we're not helping them address their childcare, transportation, healthcare, mental health, emergency financial needs, all of those other things that are going on in their lives, they're never going to have success in the workplace, long-term success. And so as you heard Bo and Joelle talk about, this is about empowering people, really helping them identify what their challenges are and move forward, and helping them meet their goals, not doing it for them, but helping them and empowering them. We do that by helping them develop an individualized plan and then taking the steps that will help them make progress on that plan. We cannot do it ourselves. We do it through a whole bunch of community partners and referrals. This is really a small list of all the program partners, funders, and agencies that we work with and we refer people to. And I also wanted to talk briefly about, during the pandemic, we had actually identified about a year and a half ago when we had a brainstorming session, what is it that our clients really need? What could we be doing differently that we're not doing now that would make things better in the lives of our clients? And we said, we need more virtual services because so many of our clients were living in poverty, but were working, as Bo said and Joelle said. A lot of them working multiple jobs without benefits and still not, having a really tough time getting by, not earning family sustaining wages or benefits. And so we started working back then to really build out more virtual services. Little did we know that this year we would, everyone would need those kinds of services. And so we had been at the point where we had been working with a consultant. We've been going through this process, mapping our services, doing all of this, all the Post-its on the walls and all the process, really at the point where we were starting to launch this, and we were going to launch a small pilot in one program to get it started. And then COVID hit and we went virtual, and within a week we were doing teletherapy. All our workforce, our workshops went remote immediately. We were doing one-to-one coaching. There were things that we had been doing before in small pockets, and suddenly we were doing it everywhere across the whole agency. And in some ways, it was wonderful because it was empowering. Staff members stopped worrying about doing it perfectly. It had to get done. All they cared about was helping our clients, and so they just started doing it. And really we developed a lot of new services as well to get the word out in the community, free community workshops, things just to get the word out there about what help was available, where to get help, what kinds of things we're doing, what kinds of things our partners were doing. And so it really freed us up to move this to the next level. We're now at the point where we're actually building out a virtual platform so that these services will be available on demand, when, where, and how people need them. Which brings me back to Joelle. Viviana, sorry, Joelle, I'm looking at you. Viviana was our client. And as I said, she was in a situation where she needed help. She needed help with housing. She needed help with caring for her children. She needed training and a job, and she didn't have internet. She didn't have technology or really knowledge about how to get to the next level, how to get out of, she was in a crisis situation. So if we go back to this wraparound service model, the first thing we did was help her find stable housing. We had emergency funds available to help her get into that housing. We helped her access diapers and food and formula and donated furniture and all those kinds of things. The same type of work that you heard about from Bo and Joelle in helping a person stabilize their lives. And then on the employment side, we helped her access low-cost internet. We helped her get a computer. There are partners in the community who are doing that. PCs for People is one of those. We were able to purchase a bunch of computers with donated funds and with CARES Act money. So we're getting computers out to clients that we're then able to work with on digital skills and on job skills and job search. And we were able to work with Viviana through that process and then help her get a job. It was a job where she was working from home, a customer service job, so that she was able to do that work and care for her children because she didn't have access to childcare either. So that's really an example of kind of what this looks like at a personal level. And then, originally this slide was going to be too about this digital divide, which, as Lisa pointed out, as everyone has pointed out, this was an issue before. We knew that it was a problem, that there were so many people who didn't have access to technology. Now it's a lot more clear One of the few good things about this pandemic is that this issue is really, there's really a spotlight on this issue now. We're part of a working group, a community-wide working group that's looking at it. There are a lot of groups looking at it. And we're really thinking about broadband access and broadband adoption as a fourth utility that's necessary for people to be able to participate in the economy. And that is broadband access, and not just access, but adoption, access to the actual technology, and then the digital literacy training and skills. And that's for, I know we're talking about employment today, but we're also working on this, and it's very much a healthcare issue, is for seniors who are very isolated right now, that we're developing a lot of virtual services for seniors and trying to get them access to decrease isolation, work that we used to do by getting people out in the community, and now we're having to figure out different ways to do it. So the digital divide is an issue for them as well. I want to briefly just talk about how we kind of quantify the impact of our workforce services. And this is one way we look at it. Last year, we helped 703 people get new employment. They earned, over the course of a year, based on their average wages going into these new jobs, $23 million, which translates into almost $6 million in taxes paid. And that was on program investments of $2.9 million. So a pretty good return on investment. So workforce services, the kind of work that Impact does, that ECDI does, that we do, this is not charity. This is an investment. It's an investment in the community, and it pays off in the impact on the lives of people like Viviana, and economically. It has just a huge payoff in helping us get our economy back growing again and helping people change the trajectory of their lives. So just to wrap it up, this is how you can, people can access our services by email, by phone. We have an online intake form that they can easily fill out and get services as quickly as possible. And if we can't help, we can refer people to somebody else who can, some of whom are our community partners on this call. So I'm happy to take any questions and to talk more about with our partners about the work that we're doing. Thank you.
Thank you very much, Karen. Chris, do we have any questions for Karen?
Not at this time.
Well, before we have some additional questions from the audience, I did want to circle back, Karen, on one of the points you made about the digital divide for our seniors in the community and their social isolation. Are there yet any programs, social programs for seniors so that they can interact with each other, whether it's playing cards online, whether it's you know, sharing recipes or cooking or the like?
We've developed a variety of programs over the last few months for seniors they're open in the community, so they're accessible too, through our website, or you can find out about them through social media. We're doing chair yoga. We've got movement classes with Ballet Met. Those are both things that we used to do live. Now we're doing virtually. We've got a book group, a movie group where they watch the movie on their own, and then it's a discussion that's available by Zoom. We've got a speaker series that we launched last week with Ben Gelber. And Ben actually does music for us too. He's got a klezmer band that plays regularly for our seniors and Holocaust survivors. And so he's been a great partner. So we're developing that to provide more opportunities for people to develop community. And we were actually talking yesterday about, you know, for many of our seniors, you know, they don't have internet access, they don't have the technology. And even if they did, you know, there's a huge barrier right now helping them use it when we can't safely be with them. So we're also working on low-tech solutions. I mean, we're delivering meals. Food is not one of our main lines of work, but we're doing food deliveries once a week as a touch point to at least have some contact and be able to check in on seniors. And then we're connecting them with Life Care Alliance and volunteer grocery shoppers and, other people like that, other organizations like that, and food banks and everything for other needs. And we were talking yesterday, one thing we're going to work on, and if anybody has ideas of how to do this, I would love to hear it. But we want to be able to offer concerts and music for people who could only access it by phone. I'd love to be able to do it on demand, but if not on demand, even if we can have time set up where people can call in. And, music is so healing, and that's been one of the things that our senior clients have enjoyed the most. So we're going to figure out a way that we can do that low tech as well, because we really, as I think Aminata said, just being resilient, figuring out, new things, being able to pivot, all those buzzwords. That's one of the things that this current situation and the pandemic has taught us, that we're figuring out new ways to do things, new ways and old ways to do things, whatever works, to be able to help people, because there's so many people in need right now.
That point about, finding a way to connect people to music through the telephone, I think that's one that can be solved. And certainly it's going to help our immigrant and refugee community members who don't have English as a primary language.
Mm-hmm.
And, music is universal. And so that's a way to interact with people, keep people's minds more active, because the brain is activated with music. So I think we can solve that one. We'll just have to find a way to have a dial-in number at a point in time. And that way we can all share that with our patients, our customers, our clients. I wanted to give each of you an opportunity, because this has been very valuable. As I shared with you earlier, 85% of Primary One Health staff are female. And we made a decision several years ago that none of our jobs were going to pay less than $15 an hour. We certainly have healthcare benefits, and as a nonprofit, our benefits are better than most and better than a lot of for-profit for sure. We also have tuition reimbursement. We pay for half of the tuition of individuals going back to school or going to advanced training. But what is it you're seeing in each of your organizations with respect to the average salary employers are paying right now? And do most of our Central Ohio employers have healthcare benefits for the clients or customers that you're serving, including those new employers that are creating these new businesses?
So I can
ahead.
start. My internet was bad, so I heard only the last part. But so for us, in terms of employers, recently, interestingly enough, I've seen some of our clients actually come in to get loans for healthcare, to pay healthcare for their employees, and I was actually very excited about that. So that is. But maybe someone can help me with the beginning of the question, because my internet.
The beginning of the question is, what is the average salary for those new businesses that are being created by ECDI? What is about the average salary, and are they providing healthcare for those new employees that they're growing?
So for our businesses, like the first to 2 years, they are part-time business owners. So average, they'll make about 20,000 because they're doing it part-time and then they have a job. But then of course, as they move away from the job and, are full-time in their business, of course, it increases to up to 50,000, but also it depends on the industry. So like we have a lot of trucking business as well. So those, it goes up to 100,000 in terms of revenue. Of course, salary, maybe 50,000. So it really depends on industry that you're looking at.
Yeah. I'd jump in too to say we're not a placement agency. We're we do workforce development. We work with businesses, and we have a lot of tough conversations sometimes with businesses about what they offer. You know, we'll have companies who come to us and say, we have open positions to fill. And so we go through an intake process with them too, and find out, well, what kind of benefits are you paying? What are the working conditions? What's the salary range? What about transportation? And we have more and more companies willing to work with us to help fill open positions, who are looking to increase salaries, maybe to help. I mean, a lot of the jobs that are looking for employers right now, or a lot of the employers that are looking for workers, are in logistics. You know, all the warehouse jobs that we have, and some of the manufacturing jobs too. We were just working with a company that's, you know, outside of the Beltway, manufacturing jobs that are auto industry positions. And these are jobs that didn't require English language skills. We go in, we learn kind of what language is necessary to get people into those jobs. You know, we have a lot of people from the New American community who are looking for employment, who were interested in the jobs, and we're working with this particular employer to help with transportation. And with jobs, these are jobs that are over $15 an hour. Actually, in the warehouse industry, a lot of the jobs are paying over just the last few years. The wages have gone way up because there's a lot of competition in that industry, and there's a huge amount of need right now. So there are more of those living wage jobs that are available. I'm not saying everybody's there. There are still a lot of low wage jobs in the community, but we try to direct our clients to the jobs that will pay a living wage and offer benefits, and, you know, give them that better opportunities.
Great. Impact, Joelle or Bo?
I'll go, and then I'm sure Bo wants to chime in on this as well. And the wages vary, but what I'm seeing on the average is about $14 to $15 an hour. The one young lady was an outlier, but in the trucking industry in which she chose, there is multiple opportunities for a higher income. But we also have to continue to market that field, which is non-traditional for women, even though a lot more women are going into that. And again, like I said, about 14, 15, we have a lot of $17 an hour positions. And I know that there's a push to make the national wage $15 an hour. I think in about 3 more years. But the problem with that is that in 3 more years, that living wage will no longer be a living wage. So
that's correct.
Again, yeah. So, you know, it's always playing a catch up. But I think that what I've heard here is awesome information. And I know that my boss is thinking some of the same things I'm thinking. Again, sharing of information, retooling, rethinking, making sure that we're on the cutting edge. But about 14, 15, a lot of $17 and $19 an hour positions that we're seeing as well.
Yeah, I'll just add to that. We also were committed to making sure that every person who worked here earned a wage of $15 an hour or more. And so we do advocate for that. Joelle is correct. If we wait 3 years to try and get to that, that will no longer be the minimum wage necessary to sustain a family. You know, one of the things we talk about is the self-sufficiency standard, and really looking at what is it that a family needs to earn when you have childcare, when you have to pay housing costs, you know, all of your utilities and groceries and everything. And what is that standard so that you don't require subsidy? And so it's actually much higher than $15 an hour, depending on family size. One of the things that is happening here in Franklin County is we have one of the fastest growing housing markets. And so we have a deficit of affordable housing. And so more of people's wages are going to their housing costs. We usually like to see only a third of their wages going to housing costs, but people are having to pay way more of their wages just to keep up with housing. And that's become really apparent to me as we've been at eviction court, and we're seeing the mass evictions that are taking place here in Franklin County. Unfortunately, we have the designation of being one of the worst in the country per capita, with over 18,000 evictions last year. So that's one of the other concerns, is that we need higher wages and we need health care so that families can truly share in the prosperity and live out the American dream.
Thank you very much, Bo, and thank you, Karen and Joelle and Aminata. Chris, do we have any questions before we close out today's session? Well, I want to thank each and every one of you, and certainly Primary One Health looks forward to continuing to work with each of your organizations to help not only your clients connect to healthcare, but for our patients to connect to employment services, entrepreneurial activities. As I said, 85% of our staff are women, and some of those women may want to start their own business. We like to promote from within, but if people have a dream, a passion to start their own business, certainly we want to support that as well. So thank you all very much, and we look forward to continuing to work with you. Have a wonderful Saturday and stay safe.